When I give short courses on yoga and Ayurveda, I first define what is yoga, then I define what is Ayurveda, and then I explain how they are connected. In brief, yoga is not only physical positions or physical exercises. Yoga is also a state of consciousness. The term yoga refers to a state of consciousness where the mind is settled. The mind has settled down in its own pure nature and expands to its unbounded status. This is a definition of yoga. The definition of Ayurveda is a science of life. It's a health science. It's a health component of the yoga tradition. And both these two, yoga and Ayurveda, are part of the same tradition, the Vedic tradition, the tradition based on the Vedas in India. The Vedic tradition has 40 different types of divisions, subdivisions. Ayurveda is one, yoga is one, but there are 38 more. Anyway, here we focus on yoga and Ayurveda. The Vedic tradition is a tradition of Veda. It means a tradition of knowledge, a tradition of pure knowledge. This tradition has been kept since times immemorial in India, in the Himalayan mountains, by seers and yogis, in the forests, in the caves of meditation, in the deep silence of this region. They have maintained the purity of this knowledge for millennia, for us today to enjoy. And in the course on yoga and Ayurveda, I'm going to go into more detail with all of this and explain what is said in the Ayurvedic texts about yoga and what is said in the yoga text about Ayurveda. All this we're going to hear, and it's going to be very interesting and enlightening. So when I give the course on diet, digestion and Ayurveda, first of all we're going to cover the 10 different body types and how each of these body types have a very specific kind of digestion. We're also going to learn in Ayurveda that there are 4 digestive types, and each of these body types and each of these digestive types have a very specific diet to follow. We're going to find out by questionnaires what is your specific digestive type and what kind of diet will balance your body type and your digestive type. We are also going to learn about the 13 different kinds of digestive processes. And we're going to understand why 2 people could be eating the same meal, but after the meal, one of the persons, he will feel very energetic and happy, and another person can feel very tired and lethargic after the same meal, or even bloated and pain. Why is that? We're going to understand in this course. We're also going to understand the qualities of food, how to prepare, how to cook, how to follow the Ayurvedic eating habits. And we are also going to understand how diet should be adjusted according to age, season, according to sleep, according to energy level, according to happiness level, frame of mind and emotional balance. All this we're going to learn because digestion is a key to having more energy, more happiness and a longer life. I'm an allopathic medical doctor. I graduated from the medical school at the University of Copenhagen. I have worked as a surgeon in gastrointestinal surgery at Gentofte Amtssygehus in Denmark, and I have worked as a medical doctor in hematology at Rigshospitalet in Denmark, the most renowned university hospital. I have also worked as a medical doctor in the US, in Tennessee, as an obstetrician. And since 2001, I've been running a private consultation office in Copenhagen In my private practice, first of all, I give advice based on the official guidelines of our country, and then I give supplemental advice based on Ayurveda, such as diet, dietary supplements, exercise, meditation, and lifestyle. There are two reasons why I practice Ayurveda, and I have chosen to supplement the standard care programs with Ayurvedic advice. First of all, the World Health Organization recommends Ayurveda not only for developing countries, but also in all countries as a supplement to standard care programs. And secondly, Ayurvedic treatments, principles and concepts have been documented to some degree by scientific research, for example, through a very vast number of randomized clinical trials. My experiences using Ayurveda is practical and useful. It is simple and uncomplicated. It is highly effective. It is precise, specific, and yet very comprehensive. I give patient education classes about 3 times a week in my clinical practice, and what happens there is that we have time to really analyze the situation of each individual patient. It's usually 3.5 hours. And what I do is I look at every individual participant and we go deeply into the symptoms, what has caused the symptoms, and localizing and identifying the root cause, the primary root cause. And then what I do is I give advice, first of all, based on the official guidelines of the country, but also supplementing with natural treatment from Ayurveda. So every individual participant will be met, will be helped, and will get advice that is appropriate for the situation. I have different topics. It could be sleep, digestion, hypertension, allergies, insomnia, or depression and anxiety, just to mention a few examples. So patients with the same complaints will arrive at the same day. And what we find in these meetings is that it's highly beneficial to be in a group of other patients who have similar complaints. And I always find in these meetings that those who come to the same meeting, they become great friends. And they often want to maintain contact afterwards. They form a network. So it's a highly successful, it's highly sought after. I have a minimum of 2, a maximum of 10 for each patient education class. So even though it's in a group, it becomes very individualized and very personal.